Concerns are growing over the global spread of the coronavirus after a spike in cases outside of mainland China. The World Health Organization's Director General has said there is still a chance to contain the virus, but the window of opportunity is narrowing. Now, the WHO has therefore called on countries to continue containment measures while preparing for community transmission, further stating that the outbreak could still go in any direction. Well, joining us now to speak on the outbreak and preventive care we need to know to contain it is Dr. Nesochi Okeke Igbokwe. Welcome to the show.
Thank you.
And so good to see you. Okay, so now the WHO says the coronavirus outbreak could go either way.
Exactly. So right now, the worry is that this can spread and become a pandemic, meaning that it's going to go globally across several continents, further exposing and infecting more people. So the concern right now is, what are we going to do in Nigeria if it does come here? To date, there have been no cases in Nigeria. There's only been one confirmed case in all of Africa, one case in Egypt. But we need to know what our plan of action is going to be if a case does come here.
And unfortunately, in the papers this morning, we read that the plans to push back coronavirus in the event that it comes to Nigeria may have suffered a setback with the Ministry of Health not being in charge of procurements and all of that. There's politics getting in the way already. I mean, what do you say to that?
So there are some roadblocks and things getting in the way, but we actually have to think about some of the good things that we are doing. For example, when I was coming into the country, in ports of entry right now, they're doing extensive screening to make sure that there are no people that actually are showing symptoms of it. So, there was a card that you had to fill out stating if you had any symptoms that were similar to those who have been infected with coronavirus, such as are you experiencing any issues with fever, cough, respiratory distress? Have you been around somebody who has been sick recently or traveled to China even? So even having those measures in place to kind of screen the population to try and ensure that it's not coming into Nigeria, those are some good measures that are being taken.
Okay.
And it's recently been discovered, I believe in the last 2 days or so, that chloroquine phosphate is effective in battling the surge of coronavirus or COVID-19.
How true that is?
Well, it's actually been confirmed by the Chinese ministries and also Nigerian authorities. Do you know anything about this, and can you tell us more?
So I have heard some of these things about chloroquine and also alcohol-based products. But in general, there has been actually no definitive confirmation that there's actually a treatment of sorts to help eliminate symptoms of coronavirus. So some things that I've read that are actually myths, some people have stated, drinking alcohol or certain products will help eliminate the virus. There's really no definitive scientific evidence to kind of solidify that. So the best thing right now that we all can do is try to ensure that we are partaking in preventive measures and strategies. Some of those things that we should be normally doing anyways in the event of any disease outbreak. One thing that's important, exactly, Victoria. So hand hygiene is essential. Hand hygiene is key. So washing your hands frequently with soap and water for at least 20 seconds, exactly.
I heard singing the happy birthday song
exactly.
twice.
That estimates the 20-second mark. So if you do that 2 times, singing happy birthday, washing your hands, that kind of gives you the amount of time that you should be trying to eliminate some of those microbes on the hands. So things like that, and avoiding, obviously, people that you know that are sick. If you know somebody's sick, don't be around them. If you know that you yourself are sick, you shouldn't be around people either, because that would increase the odds of infecting other people around you.
And for the table, because we've all recently travelled in the last week or so.
We have.
And it's very scary when you go through the airports and on the planes and you see all these people with their masks. A lot of people are applying their masks incorrectly.
Yeah.
But outside of that, I recently heard that you also need to protect your eyes because the microbes can attach to your eyes, and obviously there are vessels and veins within the eyes, so you can contract the virus that way. Tell us more about that.
So in general, the thought of hypothesis right now in regards to the mode of transmission is human-to-human transmission at this point. So what you're referring to is basically respiratory droplets that one can come into in various mucous membranes of the body. So what are we talking about? Like the eyes, the nose, the mouth. Let's say there is somebody that's potentially infected with coronavirus or any other virus, as a matter of fact. When those viral particles fall upon a table or a surface and you touch that and you place that on your face, on your eyes, or your mouth, those now become ports of entry for the virus to get into your system. So even when somebody is coughing or sneezing, if you're not covering your cough or covering your sneezes, guess what? Those respiratory particles, those droplets when you sneeze, can just fly out and cling on to surfaces with mucous membranes like the eyes, mouth, and nose. That's why it's so key that you need to take those measures to protect yourself and protect others. So if you're coughing and sneezing, cover your cough with tissue. Dispose of it appropriately. You shouldn't be sneezing or coughing in other people's faces.
You would think cough, but it happens more often than you'd like to believe.
Exactly. Now, is there anything about the genetic factor of the black race that seems to make us not susceptible to coronavirus? Because it's one of the myths out there. Because to date, not much is happening in Africa as far as coronavirus is concerned, and we're like, thank goodness for that. Outside of Egypt, of course. But how long is that going to?
And that's the thing, we don't know, because on a day-to-day basis, things seem to be developing and changing. So we don't know if it is going to actually penetrate Nigeria at all. But is there any kind of genetic predisposition that we have that, kind of protects us? No, there's nothing that we're aware of that protects us or makes us different from anyone else. But what we have to be aware of is some of the symptoms that go along with corona and travel history. And I think that's really the key. If you have some of those symptoms and you have traveled to those regions where the virus has become prevalent, or you know somebody who has been in those regions that you've been around, that's where the cause for concern is. But there's no genetic protection factor that we have.
On the topic of dispelling myths and education, when it comes to the coronavirus, I wonder if we could go back to basics and have a basic understanding of how this virus works, because I hate to compare it to Ebola, but we knew that if someone were to contract Ebola at the height of it back in 2014, it was around a 90% chance of fatality. But with coronavirus, personally, you hear different stories. It's if you contract it, you just need to incubate yourself for 2 weeks and you should be fine. But if you contract it and you already have a respiratory issue, then that's when it can be deadly. Could you just shed some light on the virus itself and how it does work itself in the human body?
Sure. So the thing with the coronavirus, it's what we call an RNA virus, an enveloped RNA virus. So coronaviruses, we've known about the family of coronaviruses for some time now. And there are a certain number of coronaviruses that actually cause human disease and human infection. So to date, before this new novel coronavirus came to play, there were 6 coronaviruses that we are aware of that caused mild to moderate to even severe disease. So about 4 of them, they were the coronaviruses that caused things like the common cold, just basic cold that people get over with some days. The other 2 viruses that we've come in contact with that have caused infection have been the SARS-CoV, which caused the SARS infection back in 2002, and the MERS epidemic that occurred back in 2012. Those viruses caused more severe respiratory illnesses that were causing death around the world as well. So now with this new coronavirus, they're calling it the novel coronavirus because this is new, something that has not been identified before that's now affecting the human population. So the theory behind how this even began was in Wuhan, China, during December of 2019. So the leading theory is that in an animal market there was some mode of transmission from animal to human. And from there on, there was human-to-human transmission that caused kind of this spread of the disease. So that's kind of where we are in it. Have we been able to kind of identify what that initial animal source is? No, to date, no one really knows, but there's really ongoing research to try to figure out what that animal source was and try to figure out how this virus is actually going to develop.
Is it likely to plateau anytime soon? Because in China, it looks like the infection rate seems to have reduced. only to hear, of course, about the prison outbreak that, put a dampener on hopes. How likely is it that this coronavirus can actually plateau sooner than later?
So it's hard to tell right now, and everything we're learning is on a day-to-day basis, but there's something that has been calculated or kind of predicted. It's called the R0. It's a value that's that researchers kind of use to try to determine, how many people will get infected with coronavirus based on one infection. So an R0 or R0, excuse me, of 2 would mean that if one person is infected with the coronavirus, there's a potential for them to infect 2 other people. Okay. So the higher the R0, the more kind of dangerous it is, and they're thinking that it can be spread even more so to more people.
And what number R0 are we for coronavirus?
So right now, World Health Organization, they started to estimate 1.4 to 2.5. Wow. That was their number initially for the R0. Other researchers have had numbers as high as 4.8. So the research community is kind of debating what is the R0 for the coronavirus. But if you put it in perspective, for a disease like measles, when we had measles outbreak way back when, R0 for that was in the range of 18. It was extremely, extremely dangerous and very infectious. So it's just going to take some time till we actually determine where things are and how things are actually going to progress.
Now, and with regards to the R0 number that you just mentioned now for COVID-19 or the novel coronavirus, a lot of people are talking about the fact that this worldwide pandemic and the panic that's going around surrounding the pandemic rather is out of place because they state that, well, if you look at the numbers, a lot more people are infected by the common cold every year than by novel coronavirus. Now, a lot of people are then saying, well, if you look at the fatalities, not that many people die. If you look at a number over 100 for the common cold, rather, it's not as high as that for the novel coronavirus. So where are we in terms of the comparison of the two? Which one is more dangerous, the common cold or the common flu or the novel coronavirus?
So right now, just to put it in perspective, more people, I can say for one in the US, are being infected with just the common cold and the flu. It is peak cold and flu season. So you need to take those preventive measures to protect yourself from that in general. The risks for those in the US and here in Nigeria is a bit minimal right now because there are no cases here in Nigeria.
Well, that's a great place to end. Not so positive.
Very much
Not
so.
many cases in Nigeria.
Thank you so much
No
for
cases
joining
in
us.
Nigeria. No cases in Nigeria.
We really appreciate it.